Good afternoon and welcome to our Responsive Home Care Talks Health podcast. We're very excited this afternoon to have some special guests to talk to us this afternoon. First, I'd like to welcome Dr. Christopher Chen. He's
Hello.
from GenesisCare. Welcome, Dr. Chen.
Thank you. Thank you for inviting us. I just want to tell you a little bit about myself. I'm a radiation oncologist. I've been practicing here in South Florida for GenesisCare, formerly 21st Century Oncology, for almost 20 years. I've been working specifically in the Plantation, the Pembroke Pines, and the Coral Springs offices. I specialize in treatment with some of the newest technology, the most accurate technology as it becomes developed. And I look forward to speaking with you later today.
Wonderful. Thank you so much. We look forward to speaking with you as well. Next, I'd like to introduce Dr. Bruce Phillips.
Hi, everyone. My name is Dr. Bruce Phillips. I also am a radiation oncologist for GenesisCare. I've been practicing in actually the southern part of Palm Beach County and also the Coral Springs area recently for GenesisCare. I've been doing that now for actually quite a long time. We'll say 25 plus years. And just a little bit about me. I went to medical school here in Florida, the University of Florida, and I became very much interested in cancer treatment and radiotherapy during that time. And I also subsequently trained at Duke University Medical Center. So kind of in a short, that's my story.
That's fantastic. Thank you for sharing. And last but certainly not least, I'd like to welcome Dr. Nasheer Sachedina.
Hi, how are you? Thanks for having us. Dr. Nasheer Sachedina. I'm a urologist here in Coral Springs working with GenesisCare. I grew up down here. My roots are down here. Went away for college at Duke and came back for medical school here at University of Miami, then did my urology training at the University of Pennsylvania. 6 years ago, joined my dad, who's been here in practice as a fixture in this community for about 30 years. So we deal with a host of urologic issues from cancer to incontinence, urination trouble, sexual dysfunction, kidney stones, etc. Our goal is basically if it's anything urologic, we should be able to handle it.
That's wonderful. Thank you for sharing. We're really excited to have you all here with us this afternoon. So first, I'd like to ask Dr. Chen. According to the American Cancer Society, a substantial portion of cancers can be prevented, including all cancers caused by tobacco and other unhealthy behaviors. So talk to us about the importance of cancer prevention.
Yeah, cancer prevention is critical in being able to prevent detecting these cancers too late or preventing them altogether. In fact, the leading cause of cancer, or the leading cause of death from cancer, is lung cancer, and that's completely preventable, nearly completely preventable diagnosis. And if you don't smoke, it's almost a negligible chance that you will ever get lung cancer. There's some small instances where you could get it for other reasons that are more complicated. However, by and large, if you can quit smoking or never smoke altogether, then you can avoid a large number of cancers: lung cancer, cancer of the mouth, the head and neck, the esophagus, bladder, amongst others. It's critical to never pick up that first cigarette, and equally important if you've been smoking to also quit smoking, because there's plenty of data available out there that shows that if you smoke during treatment, the outcomes are worse. The radiation doesn't work as well. The chemo doesn't work as well. That's just smoking. Now, other things that are preventable: HPV. If you can prevent getting HPV, or if you can get the vaccine when you're younger, then by and large, the vast majority of cervical cancers can be avoided altogether. And cervical cancer is one of the leading causes of cancer in countries other than the United States. So the United States has a relatively low incidence of cervical cancer because a lot of them are caught early due to Pap screening. So if you can do some Pap screening, or if you're very diligent about your Pap screening, you can also catch many of these cancers before they're even cancer, while they're still pre-cancers. So that's really critical since it's one of the leading causes of cancer around the world. And if you can encourage your children to also get the vaccine, I think that's going to really make cervical cancer a distant memory in the future, as well as some types of cancers of the head and neck, as well as some cancers of the anal area, amongst other areas. Alcohol is also, if you can avoid, drink alcohol in moderation, you can also reduce a lot of the risk of, again, head and neck cancers, esophageal cancer, gastric cancer, maybe some pancreas cancers, maybe some liver cancers as well. So adjustment of these behaviors in prevention is critical in preventing many of these cancers and will prolong survival.
Wow, that's some fantastic information that you just shared, some very eye-opening information, I think, especially with the global pandemic. I'm sure some very unhealthy habits have been picked up by a lot of people, especially with, how that's just a coping mechanism for them. And I think you just shared some great information that people need to hear. So thank you for sharing that. Dr. Phillips, can you tell us what types of screening and technology that you have available for your patients to help with early detection?
Yes, thank you. I'd like to, like we all say, in this past year, we've been thrust into this very difficult situation with the COVID-19 pandemic. And we also recognize that during all this, cancer just plain doesn't care about COVID. So just because we're battling the COVID doesn't mean that we're supposed to not be as vigilant as we were before regarding screening and that. So I want to emphasize to the listeners today that it's absolutely critical that you maintain your normal screening surveillance for the skin cancers, the breast cancer, the prostate, the lungs, and the colorectal malignancies, where there are excellent options in terms of detecting these cancers early. And we've all understood for a very, very long time that early detection just plain leads to better results in almost all situations. And sometimes early detection also can really lead to an easier or shortened treatment. So that's important. So please contact your primary care physician, your specialist. Go over with she or he their recommendations for screening, and let's be very diligent in doing that. And during the past year, that's been difficult. People have been afraid to go to the hospitals and afraid to do things that they would normally do. GenesisCare is a very large international multi-specialty healthcare organization, and as a result of that, they offer a great number of screening options for the prevention of cancer. Treatment obviously is critical part of what we do, but also, as you've heard, it's very important that we avoid things that are dangerous to our health and get properly screened. We have a lot of opportunities in the Tri-County area down where we are, in either through our offices directly or through the offices of our many partners in that. So I want to kind of finish that idea with saying that we are safe. We care about your safety in terms of COVID. We are certainly open for you for early detection, and if you need to have some questions or that, call one of our physicians and get those answers as quickly as you can. Thank you.
Thank you, Dr. Phillips. I appreciate you touching on that during COVID. I think a lot of patients stayed home, were afraid to go out, kind of neglected their health a little bit because they were so scared.
Absolutely.
So you definitely have to continue. I know I skipped some appointments that I probably shouldn't have, so I can't even imagine what other people in unhealthier situations may have done. So I'm glad that you pointed that out. That was a great thing to talk about. Moving forward, Dr. Sachedina, with regards to men and prostate screenings, I've actually got two questions for you. When is the right time to get a prostate exam, and what can men do, if anything, to lower their chances of developing prostate cancer?
Sure. So the first question is actually pretty loaded because it's a little controversial and there's an art to it. So when you talk about prostate cancer in general, it's very, very prevalent. And as you get older, you're at a higher chance of having prostate cancer. So there's a general adage that if you live long enough, you're going to develop a prostate cancer. Now, the flip side to that is the majority of prostate cancers are slow growing, not aggressive, and typically something you can live with as a chronic condition and may not affect your quality of life or your lifespan. The third part to this is that the PSA and rectal exam, which is what we use for prostate cancer screening, both have their own little controversy within them. So PSA is a blood test that we use, and it's non-specific, meaning a lot of different things can drive up your PSA, whether it's infection, inflammation, sexual activity, an enlarged prostate. But obviously, this is what leads us to think that there may be a prostate cancer. In fact, because it's so non-specific, back in 2012, the U.S. Preventative Services Task Force actually said that no one should have a PSA ever because it didn't give us a whole lot of information. The American Urologic Association then came back and said, that's crazy. You're going to miss a lot of people with prostate cancer who would benefit from screening, treatment, et cetera. So the American Urologic Association recommends PSA and rectal exam for patients 55 to 69 every 2 years, or unless there's a discussion with a physician and there's some other circumstances. So if you're African American, if you have a family member with prostate cancer, or even breast cancer, as there's an association with the breast cancer gene, we'll start earlier, sometimes 40 or 45, and will extend longer. On the back end of that, when I say 69 as sort of the cutoff, there's been studies that show that if you have not been diagnosed with the prostate cancer by the age of 70, that prostate cancer is unlikely to affect your quality of life or your lifespan. That being said, there are situations where we will screen later on into the 70s and even early 80s. I tell my patients if they're 80 and want a prostate exam, their parents have to have lived into their hundreds. They basically need to have a longer longevity and also be functional. So if my patient looks 60 and is 70 years old and looks 60, or is 80 years old and looks 65, there's good functionality, then we'll go later. But so that's why there is an art to it. It's very much a doctor-patient discussion. And even with the rectal exam, some studies will show that the rectal exam doesn't contribute much, that you're only going to miss 1 or 2% of cancers if you don't do a rectal exam. Our position here is that it's important because if you are one of those 1 or 2%, you don't want to be the one that the cancer gets missed. So, we try to stay by guidelines, but there's always, extenuating circumstances, and we're trying to do what's right for the patient.
Oh, that's fantastic. I am sure that you get a lot of resistance of men. I know that that's kind of the experience that I have in my household, even though I encourage it and work in healthcare. I want my husband here forever. So I appreciate the information. It's a double-edged sword, I'm sure, when you get asked that question. So thank you so much for sharing. Dr. Chen, when treating cancer patients with radiation, will other body parts be affected?
Yeah, in this day and age, generally the answer is very little, very little. GenesisCare specifically as a company has really invested heavily in the newest technology to really minimize dose to the surrounding normal structures. So there's very little collateral damage. They've invested in some of the newest technology with the most accurate image guidance technology, such as Vision RT or Align RT, to really minimize any dose to organs that are not the target volume. So some of the image guidance is so accurate that they can even detect your eye blinking. It's that accurate. So to answer your question, there's very, very little collateral.
think we lost him a little bit there. I know I've seen some of the machines that you have in the Broward offices, and it's pretty fantastic, the technology that GenesisCare has brought to, your office is right here in the backyard. So that's fantastic.
Advantage with some of our new.
I don't know if he's going to come back in or not. Dr. Phillips, is there anything you want to add since you're a radiation oncologist as well?
Yeah, I think that's been very exciting for us. I mean, I think one of the great things about radiation oncology is the technology, and certainly recently there have been so many changes in that technology. MRI directed to treatments in that over the past few years, the ability to track moving tumors like a lung cancer, and to, again, all in an effort to avoid consequences or late consequences to the normal tissue. You have to respect that too. So I don't know, did Dr. Chen come back on? Or?
Yeah, I'm back.
He's back. Okay, good. All right.
Is there any? Yes.
Yeah, so I'm not sure where you last heard me, but the technology is so accurate now. It can actually detect you blinking an eye or not. I just heard Dr. Phillips talking about the respiratory gating. So when we're treating nowadays, we can even hit moving targets such as a lung cancer, because when you're breathing, the tumor is moving up and down or this way, left and right, or sort of oblique angles with respiration, and the machine can recognize that and target that and treat it appropriately.
Wow, that's fantastic. And I was saying that the amazing thing is that GenesisCare has invested in that, and it's right here in our backyard. So that's just very wonderful. And to have that access to our community right here in Broward is wonderful. Absolutely wonderful. Doctor, so this is kind of for all of you. How do you all work together?
Sure. So can I start that one? So, sort of from the diagnosis standpoint, right? So, in urology, we'll do whatever's necessary to make the diagnosis. So whether it's prostate cancer and do a biopsy, or bladder cancer, do a resection, etc. We'll start with the diagnosis, right? And then from our standpoint, if there's anything surgical that we can do, we will offer that to our patient. That's not to say that surgery is always the right answer, but our goal in our practice is basically to do what's right for the patient, whether that is a minimally invasive surgery or radiation. It's always patient-centered. And then what's great about working with GenesisCare and Dr. Phillips and Dr. Chen is that there's always a conversation to say what is best for the patient. Sometimes it'll be, I'll think it's better for him to have radiation. Sometimes they'll call me back and say, hey, we evaluated this patient for radiation. Sometimes, they'll say it's actually better for him to have surgery. So there's no egos, there's no bruised egos, there's no competition. It's always what's best for the patient.
Mm-hmm. That's wonderful.
Not only that, I think in addition to that, for example, cancer is not a disease that's managed just by one doctor, by one specialty. It's a multidisciplinary type of practice. It's a multidisciplinary type of art. For example, Dr. Sachedina mentioned bladder cancer. A bladder cancer, for example, if the patient is going to have surgery, then the bladder is frequently removed, and sometimes they'll still need chemotherapy afterwards or radiation therapy. If only part of the bladder tumor is removed, then we sometimes will give chemo and radiation after that, and then we rely on Dr. Sachedina to go ahead and perform a cystoscopy afterwards to make sure the tumor has been cleared out and continues to remain cleared out for the life of, during the course of treatment and for the remainder of the patient's life. So just a radiation oncologist alone would not be enough to manage that disease. We would need Dr. Sachedina. We would need the multidisciplinary setting to be able to achieve the best care for our patients.
That's great. Wonderful. That's wonderful. Dr. Phillips, do you have anything to add?
A little bit. I guess two things about that. One of the things I like about GenesisCare is because they're such a large group with so many specialists actually worldwide, it leaves an opportunity. As an example, recently I participated in an international, Zoom conference having to do with treatment modality of stereotactic treatment. And it was great to be sitting in Florida and then to hear the opinion. The moderator of the meeting was actually in London. And we heard commentary about their experience from the National Cancer Institute in Turkey. And so now we have all these, not only locally, but you can address questions to your colleagues internationally. And I mean, it's a great thing for the patients, their families, and certainly for us as practitioners in that. So the other two, I say the same thing to my patients. The phrase I always use to say to them is that, cancer treatment is a team sport. So it's, ma'am or sir, when I get done talking to you, I'm going to get on the phone with a urologist or with a medical oncologist, and we're going to talk about your situation and have that opportunity to dialogue about, what is, the very best thing for that individual patient, And with cancer treatment, certainly it's not, one size fits all. So I think those are some great things about the program we have.
Absolutely. I think that's fantastic that you all work together as a team, and you all have the same goal in mind. It's what's, in the best interest of your patient. So that's fantastic. Lastly, obviously, you are a great group of physicians. It's a great company. How can people get in touch with each of you or your practice or whatnot? Who wants to go first? Where are your offices so that they know where to get in touch with you?
Sure. So we're located in Coral Springs in Broward County. People can get in touch with us, either through our phone number, which is 954-227-6747, through our website, which is Sachedinaurology.com, or through ZocDoc, which is an online appointment scheduling platform that can be done either again through our website or through ZocDoc explicitly.
Very nice.
I actually work currently in two offices, one in the west part of Boca Raton. The phone number there, if you wanted to access me, is 561-883-8656, or 561-883-8656. And also the Coral Springs office, which is 954-341-6200, so 341-6200.
Very nice. Dr. Chen? Oh, you're muted, Dr. Chen. There you go.
All right. I can be reached at 954-370-7555, 954-370-7555. Also at www.GenesisCare.com. You can find our information there. Actually, Dr. Phillips, myself, and Dr. Sachedina can all be found on that website.
Perfect. Is there anything else that any of you want to add before I say a little something at the very end?
We appreciate having us. Thank you.
You guys did a fantastic job. Again, thank you all so much. My name is Jennifer Smith. I'm with Responsive Home Care. We are a private duty agency going on 27 years this year in Broward County. You can reach us at 954-932-9647. It has been our pleasure to have you three on this afternoon. And I hope you all have a wonderful afternoon. And thank you so much for what you do for your patients.
All right.
Thank you.
Have a great afternoon.
Appreciate being here. Thank you.
Yes, it's been a pleasure.